नमो अरिहन्ताणम् ॐ नमो सिद्धाणम् ॐ नमो आयर्याणम् ॐ नमो उवज्जायाणम् ॐ नमो लोके सब्वसाहुणम् एसो पञ्चनमुक्कारो सब्बपावपणासणो मङ्गलाणं च सव्वेशिं पढमं हवै मङ्गलम् अर्हन्तो भगवन्त इन्द्रमहिता सिद्धाश्च सिद्धिस्थिता आचार्याजिन शासनो नतिकरा पूज्या उपाध्यायका त्रिसिद्धान्त सुपाठका मुनिवरा रत्नत्रयाराधका पञ्चैते परमेष्टिनः प्रतिदिनं कुर्वन्तु वो मङ्गलम् कुर्वन्तु वो मङ्गलम्। ओसवाल એસોસિએશન ઓફ ધ યુકે તરફથી આપ સૌને પ્રણામ। આપ સર્વનું આરોગ્ય સુખાકારી સારી રહે અને ખૂબ સારા કાર્ય કરવાની શક્તિ દેવ ગુરુ અને ધર્મ પસાએ પ્રાપ્ત થાય એ જ પરમાત્માના ચરણમાં વંદના અને પ્રાર્થના।
Pranam, Jai Jinendra. Good evening, everyone. Welcome to our third Oshwal Association of the UK Wellbeing and Lifestyle webinar. Today, we're looking at the subject of dementia, and we'll be learning a lot more about the diagnosis of dementia and the practical things we can do living with dementia. With us today are two eminent medical professionals, Dr. Samir Shah and Sister Shelby Simon. We also have Keshri Shah, who is going to be sharing a story today about her grandmother and living with her with dementia. But first, I'd like to welcome Nilesh Pai Shah, President of Oshwal Association of the UK, who is going to be giving us a warm welcome this evening. Nilesh Pai.
Thank you, Olaben, Jai Jinendra and Pranam Badane. Hope you are all keeping well and safe. On behalf of Oshwal Association of UK, a very warm welcome for joining the Oshwal Wellbeing and Lifestyle webinars. These webinars are kept every fortnightly on Thursdays, and I hope you'll continue joining us and looking out for the different topics on health seminars. And today's topic is on dementia. So what is dementia? Dementia describes groups of symptoms that causes the gradual decline of your brain. It happens when different disease affects the brain. So hopefully today we shall learn and discuss the potential causes of dementia, the various types of dementia, and any available treatment for it. Some facts: there are estimated approximately 47.5 million dementia sufferers worldwide. One new case of dementia is diagnosed every 4 seconds. Wow. Today, we have been fortunate to have Dr. Samir Shah and Sister Shelby Simon, who will enlighten us on dementia. Also, we have Keshri Shah, who will be sharing us her experience on the dementia with her grandmother. On behalf of OAUK, I thank all these panels who has come and given us a valuable time to our members. So without further ado, let me now pass on to Prafula Ben to commence our today's topic. Thank you.
Thank you so much, Nilesh Bhai, for that lovely warm welcome to everyone on this cold evening. Today's topic is about dementia, and to date, we have covered a number of very challenging subject matters that the community has started to have conversations about. So our first event started with mental health and managing mental health. Our second event was about organ donation. And today we are talking about dementia. As Nilesh Bhai just said, worldwide, there are millions of sufferers of dementia and more being diagnosed every day. There is a huge amount of research being done into this subject, and we are very fortunate today to have with us Dr. Sami Shah, who is going to be talking about a number of things that he has done and working with diagnostic and memory services in the London Borough of Waltham Forest and in North East London. We have Sister Shelby with us, whose day job is actually managing elderly care in a ward at the Burton Hospital. And she brings with us enormous amounts of experience about how to manage people with dementia and what are the practical things that we can do to help them live a better life. And last but not least, we've got Keshri with us, who is going to be sharing a heart-wrenching story about her grandmother, having seen her grow up, having through her growing years, and she's going to talk about her ba, who now has dementia. We will finish the session, as always, with the Q&A at the end. So please, તમારા બધા જે questions હોય about dementia, તમે અહીંયા YouTubeના comments boxમાં મૂકી શકો છો. So અમારું panel આ questions બધા answer કરશે at the end, sessionની endમાં. Last time એટલા બધા questions હતા કે અમે બધા answer પણ નતા કરી શક્યા. So please, તમારા કોઈ એવા questions હોય તો હજી already થોડા questions આવી પણ ગયા છે, પણ તમારા questions તમે એ chatમાં મૂકજો. અને hopefully આજે આ session દ્વારા આપણે dementia વિશે ઘણું જાણવાનું મળશે, અને practically આપણે કેવી રીતે dementia સાથે જીવી શકીએ એની પણ થોડીક આપણે tips મળશે. So I'd like to go now to Keshri. A very warm welcome to you, Keshri, who's going to be talking to us about her perspective on living with somebody with dementia. Keshri?
Hi. So my name is Keshri Karina Shah, and my bar Ranjan Ben Amritlal Shah has dementia. There are so many types of dementia, and Bar has Alzheimer's, which affects both the front and back parts of her brain. So you can see my bar on the screen now, and you could probably say that looks like there's nothing wrong with her. Before dementia, so I grew up with my bar and lived there until I left for university. She always was there to look after me, and she was a massive cook. She made my favorite food pretty much every single day. And Bar was an extremely proud housewife. Her whole life was basically surrounded by people, and she loved caring for them. She was always complimented for her amazing food, and it's safe to say that you could never leave that house hungry. She always knew as well, she had an extraordinary memory. Growing up, she knew where everything was in the house, even though it was filled with so many things that had accumulated over 20 plus years living there. My Ba and Dada lived together and were married for 50 years, and they had their own routine. They were very much early birds, and at the crack of dawn, they would wake up and prepare food for the day. And even before you could even sort of come downstairs, they would ask you, what did you want to eat for lunch? And those are just some of the things that I remember. So the early stages of my bar having dementia, what did I notice? We started to notice some little changes, more prominently after my dada had passed away 4 years ago. It became more obvious that he was the one that kept her in routine. He always had quite high expectations, and Bar somehow lived up to them. She would always sort of cook for him and do things his sort of time frame. And surprisingly, that's what actually helped her to keep that routine, probably stopped her from getting worse. So after, sadly, he passed away, the routine shortly just became more difficult for her, and small things became really challenging. So losing track of time, not knowing what was going on, and it seemed to become more and more common, and it sort of overpowered her. So the signs and symptoms that we sort of noticed, frustration was a big one. Bar would sort of get frustrated that she wasn't able to communicate. She wasn't able to express what she wanted. Not remembering a time or a place. These are things that for all of us, we take for granted, but this became increasingly more difficult as time went on. Beginning not to want to shower. Now, this is something that we didn't really understand at the beginning, but it caused more frustration, and it almost, something that was so simple was really blown up into a magnitude of different things. Misplacing things, hiding things that she'd formed some sort of attachment with in terms of the past, not knowing where Dada was. This was a really hard one to watch. Constantly going through this cycle of grief was quite difficult to explain to Bar. Sometimes her reaction would become acceptant. Sometimes she would laugh and say, oh, you know, I know that. So there was different things. Accusing others of stealing. Now, this is one that for any family, it can cause immense strain and upset. Lack of sleep and very anxious behaviour when at home. So Bar increasingly needs a very calm environment. Any small things can be quite overwhelming for her. And this is now becoming increasingly common. So present day, it's challenging. Over the past year, given the lockdown situation, there's been an immense strain on not only myself, but also family not being able to visit frequently. It took a long time for me to accept that she's no longer the person that she was. And to be honest, now I focus on the small things that make her happy. And to be honest, it's become increasingly important for me to do the small things with her that keep her smiling, whether that's playing cards, eating together, or just doing things like playing Snap. We try and remain as patient as we can, even though this can be extremely mentally draining. But it's important to remember that this is still my Bar, and regardless of however she is at this moment, we'll still continue to care for her as she's quite vulnerable. And without that care, she will become even more isolated and confused within her own thoughts. So things I'd like you guys to take away from what I'm saying and having and living with someone with dementia. Dementia is a really tough journey, and it affects different people differently. Please take every day as it comes. You'll need to realize that there will be both good days and bad days, but there are small steps that you can take that lighten the mood and lighten basically the responsibility for everyone involved. Bar wants the whole house to be full again, like it was 20 years ago, where everyone used to live together and used to make food that probably served 40 people. Obviously, that doesn't really happen now. So things are a bit more difficult. Hopefully this talk will shine light on how to manage dementia. I want to keep Bar smiling, and regardless of dementia, that will always be our family's focus. And I hope that this will help someone out there. Thank you.
Thank you, Keshri, for that really detailed account of some of the challenges that BA faces currently, and how you are all managing to live with her and help her through this very difficult time. There are a couple of takeaways from your message there, and I hope people will find that helpful. I would like to now introduce our next guest, Dr. Samir Shah. He's a consultant neuropsychiatrist with over 17 years of experience in London within the NHS. Dr. Shah has served for the past 7 years as lead clinician in diagnostic memory services for Waltham Forest in East London, and chairs the memory services for North East London. Since 2021, Dr. Shah has been appointed Deputy Associate Medical Director, leading adult and older adult transformation across Waltham Forest. And under his leadership, he actually has several accolades given to him, and he has won several awards for his work. His wonderful work that he's going to talk about today is that he's a co-founder of the Dorothy app, which is an innovative approach using computer vision for augmenting reality to guide, monitor, and assist those with dementia. Welcome, Dr. Shah. Thank you so much for giving us your time today, and looking forward to hearing what you've got to say.
Thank you very much. You've already done my introduction for me, and Keshvi, that was really touching. Thank you for that. I personally couldn't have done a better introduction to dementia myself. It's really important that, particularly over the past year or so, with COVID, it's been a really difficult time for people. So as mentioned, I'm Samir Shah. I'm a consultant neuropsychiatrist, and I run memory services for North East London, and I also am a NHS England clinical entrepreneur, and I'm a associate medical director in Waltham Forest. What I was hoping to do today is talk about a few things. If people would like me to, I'm happy to share the slides. I've pulled up some Gujarati language resources at the end. And we're just going to go through a few things. So a little bit about what dementia is, why it matters to the Asian community, warning signs, why should you get a diagnosis, a bit about prevention, a little bit about the Dorothy app, and then at the end, I think probably the end of the session, some questions as well. Okay, so when you look at death certificates, dementia is the leading thing that's on there. So it's the leading cause of death in England and Wales, and 1 in 6 people over the age of 80 have it, and 1 in 3 of us will have it when we die. It's a huge economic burden across the world, with $1 trillion of care cost, and it's going to double in 10 years and triple in 20. So we're really trying to. It's really something that's going to be quite major on going forward. Now, interestingly, when I say disorientated and agitated, often it means when people are disorientated and agitated when they don't know what their needs are, and that's how they often express pain or needs. And so 1/10 of that cost we can bring down by really tailoring our care for people. And it's really tough. It's a really tough thing being a caregiver. Half of all caregivers have clinical depression. They nearly all feel they have to be with them at the time they come out of work. It's normally just one person. So what I'm trying to say, well, I suppose what we'll try and say here is we need to find ways of sharing the load a bit, because it can't go on one person. And it's a really difficult thing to position to be in, and a really difficult job. So what is it? In simple terms, it's progressive cognitive loss, and it affects lots of things. So it affects particularly short-term memory. Now, there's lots of different types of dementias which we'll go into, but particularly affects short-term memory. It affects thinking, so it might affect the way in which you think. It might be a bit slower, might be very slow. You might only be able to think about one thing at a time, or the order in which you think might be a little bit out of order. Your mood might be affected, and your personality might be affected. And that tends to affect younger people a bit more, but it can happen in older people too, mostly over 65, but 1 in 20 people that are diagnosed are under 65. And lots of causes. The most common is Alzheimer's, which is about 60+% of all of them. And that's to do with different proteins being deposited in the brain. We don't know exactly how it works yet. We've got a good idea, and there's lots of treatments that we're trying to think about, but we don't know exactly how that works yet. And the other main one is vascular. And that's to do with the blood vessels. So if somebody has a stroke, for example, and the brain is damaged in that way. The other two are something called Lewy body, which is a cousin of Parkinson's. And then the type that affects the younger people more is something called frontotemporal, which is more to do with mood and personality. And one thing I wanted to say is that it affects the whole network of people around the person with memory problems. So it's not just the person with memory problems, the carer. It's the care staff that look after them. It's the bank. It's vulnerability issues. It's going out in the car. So it's all of these things that are that come together, and we need to think of these things as a whole when we look after somebody. So why does it matter, particularly to the Asian community? Well, unfortunately, our communities tend to go for diagnosis less and later, and the difficulty with that is that people who have an earlier diagnosis tend to do a bit better long term, and there's lots of barriers to seeking a diagnosis, and sometimes it's because the service is not aimed at ethnic minorities, and that's something that we're trying to change. But there's also, unfortunately, with our communities, a lot of stigma around the diagnosis. A lot of people don't like talking about it, and sometimes people feel it's part of aging. Now, when one ages, you're not necessarily forgetting everything. You might find it a bit harder to remember, but it's very different from the normal process of aging, and mostly due to some of the symptoms that I spoke about earlier. Now, when I said earlier that dementia rates are set to double and triple in 20 years, Asian groups are going to be particularly affected with that, and that's more to do with lifestyle factors that tend to be more in Asian communities, so things to do with the heart, really. Okay, so when this is really about when to get a bit worried. So being a bit forgetful is normal. It's completely normal. You know, we leave our keys somewhere, we forget about things that have happened. But you need to be concerned when short-term memory is getting worse and worse, and it's affecting daily life. Sure, they can remember what happened 20, 30 years ago, but can they take in what you just told them? Or do they need to, are they repeating it? Are you saying it again and again and again? And is it stopping them from doing things? So those things might be quite familiar tasks like cooking. They might be leaving the gas on again and again, or they might be they might be forgetting to put certain things in their recipes. They might be getting lost where they perhaps should not get lost, where they've been living for a long time, or having difficulty driving. A common one is having trouble looking after their money. So often what people would be able to do is pay for the paper or something, but not be able to pay for the larger bills, and misplacing things much more than they used to. Where is something? Has someone taken this? It becomes harder for people to recognize people that they should know. So if it's a family member and they're starting to finding it hard to remember who they are, that's quite a big sign. Confusion around time and place. Now, we all forget what day it is. We're all stuck inside, and we all forget the date, but forgetting the year, forgetting the month consistently is another big sign. Often people have trouble finding the right words. They'll understand you, but they just can't get the right word out, or the writing's changed, it might become smaller. So these are all small signs. It can also affect your mood, behavior, and personality, and that tends to be for younger people first, but that can be an early sign as well, and vice versa. Sometimes mood changes if let's say something's happened and someone's mood has gone down. Often we see people where we say, okay, this looks, people have memory problems here, but it's because of mood problems. So mood can be a cause of a symptom of dementia, but it can also, you can have memory problems as part of mood. So that's something that we need to look at when somebody comes to our clinic. And then finally for this slide, I suppose it's saying, don't blame yourself, because these memory loss changes can be very slow and they can take months and years to develop. And if you're with them all the time, you know, it's easy not to notice those things. So sometimes when the people that really notice are the people that might see them once a year, for example, and they'll really notice changes in that person. Okay, so why should we go to the memory clinic? Well, the first thing is to rule out common causes for memory loss. The first one, as I mentioned, was depression, which is a very treatable difficulty. But there's some blood tests that we do. So there might be thyroid, there might be B12, folate, things that we can reverse. So that's the first thing. Some people have slight memory loss and they're still getting about their day and they don't really need help. Now, most of those people will stay as they are, but over 3 to 4 years, there's an increased chance of them getting worse. So we get a baseline, which is a very useful thing, both in terms of scanning and memory testing. To minimize risk of progression, I'll come to that shortly, but there's a bunch of factors that you can do to reduce your risk of memory loss later on. And then, you know, if it's to get an early diagnosis. It's a really strong predictor of outcome.
Sorry, Dr. Shah.
Yeah.
Can you please speak up? People cannot hear you well. Please.
Okay.
That's better. Thank you.
So to get an early diagnosis, and it's a really strong predictor of outcome. It's about planning for the future, but doing it in a way that's around you. Yeah. It's about your cultural background. It's about what you want. I'm really thinking about that. Because it might be difficult for you to express that in the future. It's about reviewing care needs. So what do you need at home to be comfortable? What extra things does your family need? It's to look after risks as well. So sometimes people are getting lost. Sometimes people are having trouble in the kitchen. There can be a range of risks that we can help with. Signposting for long-term care, carer stress, support. So you might need somebody else to come in. The carer we might be able to refer for things like brain training or for psychological therapies for carers, which we have as well. And then finally, and I put this quite low, it's medication that slows down the decline, but also other medication that you might be on that may be making your memory worse that we can look at. So we can do a lot of things. We can do psychological therapies, look at what your needs are, look at your medication, try and look for reversible things. So there's quite a few things that we can do. But what I wanted to talk about really was prevention. And this is quite a busy slide. It's from the Lancet from last year. Essentially, it means that about 60% of the risk for Alzheimer's, which is one of the main type of memory loss, we don't know. And education, but the rest of it is we're able to change. But the interesting thing is that towards the end of life, depression, social isolation, and physical inactivity, they all add up to more than your education level. So later on, if you're able to go out, see people, this time currently by Zoom, or even go for a walk every day, that's really important. It's more important than controlling your diabetes, for example, and about as important as controlling smoking. But the really interesting thing that I can see here is that in midlife, if you've got hearing loss, it's more important than if you've had brain injury. So it's really important that you wear your hearing aids and get your hearing checked. And that's something we're doing in our clinic. We check everyone's hearing when they come in. So this is a really easy to kind of follow chart that, again, I'm very happy to share. Okay, so I just wanted to really briefly talk about the work that we're doing with something called Dorothy, and it highlights some of the things that that we spoke about. So as I mentioned before, I'm a NHS England clinical entrepreneur, and we bring in new innovations that we set up ourselves. And okay, so what happens with dementia is that people are quite easily disorientated, and their places of care are not really the places they're used to. And so what we wanted to do was convert their walker, which about 10% of people use, into something a bit smarter that can orientate people, and that can map their environments for them, and then they can take it wherever they want to, so that they can locate their bedroom or their bathroom or whatever needs to be, and then that will then send data to the carer just to make sure they're okay. So just to go through quickly, this is what it looks like. So this is what's on their walker, and then it shows a live location and what they're doing. As you can see here, what we've done is that we've made it really simple, because if you have problems at the back of the brain, complex shapes are really difficult for you to take in. Let me just go to one of the other slides here. What we can see here is that it's very simple icons, because people find it difficult to see these things. They much prefer icons, particularly again in our populations. People tend to forget their second language. So what we've been doing is that we've been allowing carers and family members to call into the care home. They assist the person on the iPad, and then they use that to navigate the care home. And we just started doing this really, but people are now being able to find their bedrooms for the first time, for example, and they're able to navigate through, or they're able to say whatever they need. And then later on, the idea is that because we know what people are doing and when they're doing it, we can then have ideas about what their needs are. So for example, are they brushing their teeth? Are they sleeping properly, etc., etc., etc. And last year, really proud to say that we won an innovation prize, international innovation prize for this. So again, I'm very happy to answer questions about that. I think that's essentially most of my talk. I'm happy to answer any questions that need be. I'm just going to stop sharing. Okay, I'm just going to share this final. Oh, hang on. I don't know how to share my screen. I'm just going to share this final screen because I put some links there that are. My details are at the bottom, and I put some information in Gujarati as well. So I'm very happy to share these slides if need be. Okay, thank you.
Brilliant. Thank you very much, Dr. Samir Shah. Very informative presentations, lots of really good information there. I'd like to now welcome our next guest, and she is a senior sister, care for the elderly at the University Hospital, Derby, but the Burton site. Sister Shelby Simon, welcome to our webinar where you're going to talk to us more about practical things we can do to manage people with dementia and how we help them. Do talk in Hindi if you prefer to do that. And I will now hand over to you for your presentation.
Thank you, Profila ji. Namaste. Thank you for the introduction, Profila ji. I'm Shelby Simon, Senior Sister at Queen's Hospital, Burton. Would like to thank Ms. Shah and everybody else for giving me this opportunity to share not only my work experience, but also to bring some of my own personal experience too. As we understand, dementia can have a significant impact on a person's daily life, including how well they function with their own home. Memory issues or problems recognizing can cause the person frustration or create safety issues. To help the person with dementia maintain their independence and to support them to have a good quality of life, it's important to make their home as easy to manage as possible. So if possible, try to involve the person with dementia in decisions about any changes you're making. I'm now trying to cover the topic I have been given, the practical aspects of living with someone with dementia. Dementia is such a complex and a vast subject to cover. Today, I'm going to touch base on 5 main elements, the practical aspects, which may come useful if you are someone caring for a loved one with dementia. So as you're seeing, the 5 elements I'm trying to touch base on: communication, home safety, the medicine management, legal side, and caring for the carers. Dementia can affect someone's ability to understand words and language, like Dr. Shah said, which can then make the communication more challenging. So a person may have lost a thread of their conversation, forget some words, talk for a long time, repeat the same things over and over. Most importantly, have problems expressing how they're feeling, their emotions. They could be angry, sad, hungry, whatever emotions they're going through. So I'm going to share some communicating tips, as you're seeing in front of you on the screen. Approach the person from their front. So maintain an eye contact. So say their name or relationship. So whenever you're communicating, try to use their name. Keep it simpler. Try not to make it overcomplicated. Speak slowly, showing some empathy and understanding. Keep it simple, like I said. Do not argue with them. Rather agree. Rather join their reality. Most importantly, there is one thing we experience in the hospital, and I really want to share that with you. Try to not stand too close to someone when you're communicating. So if you go and stand right in front of them, so for example, at hospitals, we do face some situations like the person gets quite agitated, they could be distressed, they want to leave, they're not going to listen to anybody, they might not listen to the nurses or the carers taking care of them. We may at times having to call securities. And I have seen the difference of the person's approach. Sometimes the security, if, the way how they approach, if they go and stand right in front of them, basically the person feeling more vulnerable, they're feeling very intimidated. So, they probably try to react to protect themselves. So you might feel, see some kind of aggression physically or verbally. That's only because that person is trying to make themselves safe or protect themselves. So when you're conversing, when you're communicating with a person with dementia, stay at their same level as they are. Another thing to remember,
Shelby, I'm really sorry to interrupt you. Can you speak up just a little bit, please? Because people are having difficulty hearing you.
Okay.
Thank you.
Can you hear me better?
Yes, that's better. Yeah.
Sorry about that. Okay. Right. So in communication tips, do you want me to go back to where I was, or am I okay to carry on?
If you just carry on from here, that's absolutely fine. Thank you.
Okay. So remember, older memories are easy to remember than the recent ones. Please don't be offended if you're not being remembered by the person at the time. It's not you, it's the dementia. Here I'm going to share some of my personal experience. One of my cousin being recently diagnosed with dementia. She has got 5 kids and obviously her family. It's quite sad, and it took us time to come to terms that she is not recognizing or understanding even her husband. She recognized the person from the familiarity, but she doesn't really know what relation, or she cannot define because she's already having problem in finding the words and memory issues. So, in conclusion with communication, I would like to say, remember, we communicate a lot through our body language, facial expression, or with our tone of voice. Like I say to my husband here, when we have a little arguments, it's not what the word that he used, it's how you say it, the tone of your voice matters. So if we as a carer seem positive, cheerful, confident, we bring a sense of hope and reassurance to the conversation. Whereas if we seem unhappy, resentful, we can bring a sense of gloom. Having dementia does not mean that the person have to feel ill. There are lots of things we can do to support the person and help them live safely and well at their home by making some simple changes. So the changes you're making doesn't have to be any expensive ones. Simple changes, but they are handy. As you see in the picture, reduce clutters. Make sure there is nothing lying around on the floor, such as wires or leaves, or remove rugs so that you can reduce the risk of falls. A well-lit home can be useful for a person with dementia, as this allows them to find their way around the house. So for example, leave the bathroom door open or the light on the night. Consider sensor lights if the person gets up during the night time. The next thing you can consider is keeping important items in the same place. Or you can use some labels on the cupboards or with words or pictures so the person can easily identify what they're looking for. You can also consider leaving some notes on the key areas, as in, don't forget to lock the door. So like I said, dementia doesn't make the person ill at the early stage, definitely not. So they can continue to have a normal life balance. So if they tend to go out for a walk, so having a key, having a note left on the door side, don't forget to lock the door, or keep the key in the same place. Remind the person that they need to do that. Another thing you can consider is a key safe. You can have a key safe fitted outside the house, like you're seeing in front of the screen. That can help you store a spare key just in case. Other things you can consider using within home is using a whiteboard. That can be with a list of things to remind them, or this can also be used as a communication tool between the carers and the families and the patient, of course. One more thing I'm going to show that's going to help you is something called a dementia-friendly digital clocks. This will keep the person with orientation, having displaying the date and time and the year. There are other things you can consider using. As a pendant alarm or a personal alarm. This can be worn by the person on their neck as a chain, as it's showing in the picture, or on the wrist. So or you can even keep it the house somewhere within the room or wherever. So this can be pressed in a matter of in an emergency situation, or if they had a fall, to alert the family. So you can obviously get help from local authority to see services offering this within your area. The next topic I'm trying to cover, or the element or the practical aspect I'm trying to cover, is safe use of medication. There can be a lot of issues around medication, such as not taking them, missing the doses, or simply overdosing them. So here are some tips that you can try to use. You can consider using a dosage box, which obviously has got a week supply, or you can have more boxes with the date, the time, etc. Or a blister pack, which is also known as a Venilink, or you can also use a prompt sheets. So as a family, you can get an idea: is the person taking the medications? Are they missing, or are they taking? Are they overdosing on them? So you get some control and understanding. If there is an issues with medication management. Some other practical points for ensuring the safety that you can try on are door sensors and gas alarms. Or you can actually disconnect the gas cooker, encourage the person to use a microwave instead. If the person, for example, prefers to use the gas cooker and you think they are safe to do so, then speak to your gas supplier about fitting a gas valve limiter. These are usually free to install, and it's useful if you're worried about the gas being left on, so reducing the risk of fires. You can contact local fire safety service to do some home fire safety checks and to check the smoke detectors. One more thing I'm going to touch base on the home safety is try to maintain the same door color. So that, so if the person's memory, always been whatever the color of the door being, try not to make any changes to that, so that you can avoid any confusion and easy return home. As like I said before, dementia is a vast subject. There are many more aspects that needs covering, especially as the illness become progressive. You might need help more with the living aspect. So an occupational therapist can support you. So if you get a help of an occupational therapist, they will be the person who can help you for more practical side of the help that you need for future. Now let's look into the financial side, the legal side, the money matters. So I'm not sure, I don't know how many of you have heard of or familiar with the word of lasting power of attorney. So there are two types of it. As you're seeing, it's the health and care, welfare, or financial decisions. So what is the lasting power of attorney? A lasting power of attorney is a legal document appointing one or more trusted people to be a person's attorney, a person who is responsible for making decisions on their behalf. Only thing that you have to bear in mind that you can only set up this by a person when this person has a mental capacity to take that decision. Therefore, consider setting up a lasting power of attorney at the early stage of their dementia. There's one more thing, as you can see, did you know, as we all know, 100% of us will die, but only 3 by 10 have discussed their wishes with families. So here comes the role of an advanced care plan. This is not just applicable for dementia, it's also useful for somebody with terminal illness or anything else. So things you can include in an advanced care plan are, you can prompt the person to again complete this advanced care plan when, the early stages of the dementia. So you can get, how would you like to be cared for? Where is your preferred place of death? What does matter to me now? What is important to me now? Or things like, about your fuel arrangements. It can be anything, what matters to that person. So this is something you can think, speak, plan, and review as you go along. Unfortunately, dementia is a progressive illness affecting one's memory. Another challenge we encounter both at hospital and at home are the person get lost and then therefore go missing. So at hospital, we, person can go missing at any place where they are. They can be in the hospital, home, care home, wherever they are. They can go missing because of the confusion that they do have. So at hospital, we have got some guidelines that we follow. If the person leaving, if the person actually left the hospital premises itself, we then get the help of the police to support us finding the person. So at home, this is something that I'm trying to encourage people to use or trying to introduce, something called a Herbert protocol. If you care for someone with dementia, you can complete something in advance called a Herbert protocol form containing information about the person to give to the police if the person goes missing. So if you imagine if the person gone missing and there will be an element of stress, panic, you might not be able to give all the details and the description of the person. So this will then come handy and useful. So bear that in mind. Now, the last but not the least, the practical element that I mentioned, I would like to cover is looking after someone with dementia can be a 24-hour-a-day job. Practically speaking, you can only care for someone well if you are in good health yourself. Caring for someone with dementia can be extremely difficult, so try to be kind to yourself. So, for example, if you are someone caring for your mother, your father, whoever the relationship is, if you have got siblings or other close family members, they might not understand what you're going through. They might be thinking you're coping fine. So it's okay to accept help from family and friends. You can having a carer coming in on a regular basis will enable you to have a break, so the carer can give time and you can have a break if you like. There are other services out in community that you can make use of, things like a day center. So, the person with the dementia can go to a day center, spend a day in there, whilst you get time to actually enjoy a day for yourself. But the person who goes to the dementia center, they do have got other activities happening in there, or, they can interact with other people. So it's good for them and for yourself. So consider making use of a day center. As a carer, you also need time for yourself, enjoying what you do, listening to music, going for a walk, or maintaining other important relationships, as well as looking after your loved one with dementia. So that will help you keeping yourself both mentally and physically happy and healthy. So you can, I'm not sure if you understand or if you're aware of that, you can also request for a carer's assessment from social service to see if you're entitled for any kind of benefits, or, such as council tax discounts, attendance allowance, or a carer's allowance. You may also be entitled for a respite care. So, you probably can send the person with the dementia for a week or two to a respite care where you get time to go for either a holiday, recharge yourself, and, have a break, and then obviously be ready to be back on looking after your loved one. So if you would like to know any more details about, the respite care, you could contact either your GP or your social service to get more information on that. In conclusion, please don't struggle alone. always remember there are people and services available who you can contact for advice and support. Sometimes just a little bit, help can make all the difference. Thank you for your time in listening to me. Please feel free to submit any questions you have, and I'll try to answer them later in the question and answer session. Thank you.
Thank you so much, Sister Shelby. That was absolutely so helpful to hear so many practical tips there about the things people can do around their home and other things that you can do to help people. We've got people who've joined us from a global audience. There are some people here from Dar es Salaam, for example. And there are many, many questions that have been put ready for our panel. So I'd like to introduce Jyotiben Shah, Macmillan consultant and neurological surgeon at the University Hospitals of Derby, but at the Burton site. Jyotiben is going to manage the Q&A with our panel, which this evening will include both our medics and of course Keshri, who told her daddy's story. We've got Nilesh Bhai still here as well. And so we've got a lot of questions, Jyotiben, so let's get on with it.
Thank you, Pratima Ben. So if I could invite Keshri Ben, Sister Shelby and Dr. Samir to join in, please. બધાને મારા જય જિનેન્દ્ર. અત્યાર સુધી આપણે શું શીખ્યા? યુકેમાં દરરોજ 600 લોકોને ડિમેન્શિયા થાય છે. ઉંમર સાથે ડિમેન્શિયા થવાની શક્યતા વધી જાય છે. 65 વર્ષથી વધારે ઉંમરની ગ્રુપમાં 14 માંથી 1 જણને ડિમેન્શિયા થાય છે. અને જ્યારે 80 થી વધારે ઉંમરવાળાના લોકોના ગ્રુપમાં 6 માંથી 1 જણને ડિમેન્શિયા હોય છે. ડિમેન્શિયા દરેકને અલગ અલગ રીતે અસર કરે છે. આપણા મગજને કારણે આપણે વિચારીએ છીએ, કરીએ છીએ અને બોલીએ છીએ. આપણા મગજમાં આપણી યાદો પણ રાખેલી હોય છે. ડિમેન્શિયામાં યાદ રાખવામાં, વિચારવામાં, બોલવામાં અને બાબતો કરવામાં તકલીફ થાય છે. ડિમેન્શિયામાં જેવા પહેલા હતા એવા વ્યક્તિ હવે નથી હોતા. હજી બી તમારે કોઈ બી પ્રશ્ન પૂછવું હોય આપણા પેનલને તો પ્લીઝ તમે ક્વેશ્ચન્સ લખજો ચેટમાં. અત્યાર સુધીમાં તો ઘણા બધા ક્વેશ્ચન્સ આવ્યા છે એટલે we will try and answer as many as possible. અમુક ઇંગ્લિશમાં, અમુક ગુજરાતીમાં અને Sister Shelby maybe in Hindi, right? So if we could start, thank you so much to our panel. It was very informative. That was just a brief summary of what you've educated us about so far. Keshri, that was a very, very brave thing to do today, to come out and talk about what is actually a stigmatized topic. And I think Dr. Samir has already said that in the Asian community, apre loko vela agar nathi avta ani e bhi kalank na hisabe. એટલે આપણે અત્યારે આ conversation શરૂ કર્યું છે તો આના કલંક આપણે તોડવાની જરૂર છે. So Keshri, if I could ask you, what advice would you give to other young people who are in a similar situation to you? And we've heard that there's a growing number of people who are in your situation.
I think what I've learned from this whole process is give yourself some time to accept it for what it is. The more you fight against it, it becomes more and more challenging. With lockdown, I think the hardest thing has been to ask for help, which is in fact probably one of the most important things that I can say. I was due to actually go on a dementia course myself, but then we went into a lockdown. So I wasn't able to do that. And I think it would have actually, had I done that, that would have been immensely really, really important for me to do that. I still spoke to someone that was actually from their team, and that in itself, speaking to someone outside of family, I think it's really hard to vocalize how you're feeling. I think especially for someone so young, you know, I don't want to put extra strain on the family, and I don't want to make other people upset, you know, but it has been really difficult to watch my gran go through that. So yeah, I think really important to seek help and professional help if needed. It's not an easy thing to go through.
Yeah. And you're obviously going through a mourning process, aren't you? Because
Yeah.
there's the person whom you knew years ago, because
Yeah.
the person in front of you now is different.
Yeah, I think, you know, there's things like I said, that do make her happy, and I will always do my best to sort of focus on those things. But equally, like I said, it's not just the person that's going through dementia that suffers with an immense amount of pressure and strain. It does cause you to, like you said, become sort of upset, angry, frustrated. So you've got to give yourself some time as well. You've got to, you know, realize you're not superhuman all the time. I can't forever keep patient, you know, it's really quite challenging. But knowing that, you know, there are good days in it as well, you know, there are talking about memories, that there's things that I never even knew that I've learned from this. Not to say, obviously, like I said, there's challenging moments, but there equally is good times as well. And I think I'm valuing the time that she has got, rather than thinking, oh, do you know what, she's gone cuckoo. And I think that's the stigma that most Asian communities do have. Oh, magaj vayogyoche. Don't bother talking to them in the same way. They're not going to remember it anyway.
And that's
but
what I'm hoping to do by starting these very difficult conversations in this.
Exactly. I think,
and hopefully,
I think it's important in that way.
Yeah, no, thank you, Keshri. That's really been a very brave thing you did today. We're very proud of you.
Thank you.
So on that note, Sister Dobby, if I could come to you, where do people go for help? Is there a particular department in the council that people can go to get practical help? Perhaps not just to look after patients with dementia or loved ones with dementia, but elderly relatives.
Okay.
Can you signpost where people go?
Okay. So first of all, I think, you know, people don't even understand they can actually contact the GP to start asking where they can go to or what sort of help's available. So your GP surgeries normally they should guide you with information where they can get more help from. Social service, you know, the GP can give you details of social service. There are occupational therapists which you can hire as private, or there are, you know, through NHS service itself. There are people like, you know, there are many more services, to be honest. And for more details, if you like to know more, dementia.uk on the website itself gives you hell of a lot of information that you need for the practical side for living with somebody with dementia, because it's sad to hear from what Keshri has gone through or going through with her grandmother, not understanding. And like all of you have mentioned, in our Asian community, we do have this social stigma. We do not want others to think that we got somebody with dementia or mental health illness. Therefore, we don't ask for help and suffer in silence. We don't even ask for help from our families. You know, we may have got other siblings or other people live nearby. We tend to keep, you know, suffer ourselves and think, you know, we will cope, it's shame, you know, and we then become more and more stressful. So there are many services out there, you know, that you can get Alzheimer's, dementia, UK. So like I said, there are many other services that you can actually get help from in community. So starting from
that's really useful.
Or, you know, social service.
So we've had so many people who have related to your story, Keshri. You know, we've had a message from a member who says their mother is 94 years of age and has got dementia, gradually getting worse, forgetting within seconds, but can remember the past, which I think, Dr. Samir, you will agree, they often remember older memories rather than the newer memories. you know, she used to love reading Gujarati newspapers, but doesn't want to read. And I think the comment we received on this story is that coronavirus hasn't helped. So the pandemic hasn't helped people reach services where previously they may have been able to get help. So, I mean, Dr. Samir, on that note, if I could ask you, if we think a member of the family is displaying signs of dementia, how easy is it to get a test and a subsequent diagnosis?
So just to, I just wanted to add a little bit to the question that you asked, Keshvi and Shelby. I just wanted to add a couple of extra things that you should probably do early. Okay, the first one is find out what music your parents like. Okay, because people react really well to music that they know from the past. Okay, and the other thing is, it's not an easy thing to do, but Shelby mentioned it. Do power of attorney and do advanced care planning. Even if you're 50, do it. Yeah, because it really, really matters. Coming back to how easy it is, it's very easy, very easy. Pre-COVID, we had a waiting list. Well, we kept our waiting list to below 4 days. So all the GP needs to do is do some blood tests and a basic memory test, and that's it. It's a bit longer now. It's more like 3 weeks, but it's not long right now. So go and see your GP, basically. If you don't want to speak to your GP, there might be some district nurses there. Sometimes there's outreach to Temple. So there are lots of ways, but the easiest way is to go to your GP, because there are lots of things that can mask memory. So the GP will check some of those things first. Okay.
Yeah. And that's quite useful, isn't it, Dr. Samir? Because people will think, you know, આપણે બધા ભૂલી તો જઈએ છે ને કે ચાવી ક્યાં મૂકી છે ને આપણે ગેસ બંધ કરીને ગયા છે બારે. But and then you start thinking કે હું ભૂલી ગયો છું, does that mean that I've got dementia? And it doesn't, right? Because બધાને dementia તો નથી. So, you know, there are lots of drugs, particularly as you get older, the anticholinergic drugs that we give can be the cause depression, stress, anxiety, thyroid problems. That doesn't mean you've got dementia.
So lots of things.
Yeah.
But then if people are commenting your memory might be not great, then you should go, basically. The other thing I would say is get your hearing checked as well. The hearing is very common, and if you can't hear, you can't remember. Yeah. So those two things.
But the problem with that, Dr. Samir, is once again, people go and get a hearing test, but there is this embarrassment in our community for wearing hearing aids, right? And again, another stigmatized subject. So people don't want to wear it. So this is a vicious circle as well, right?
It's very difficult. It is very difficult. But yes, when you should get worried really is saying, well, okay, look, would I let mum be by herself for the weekend? Yeah, that's probably when to get worried, because if you're a bit forgetful but you can get on with things, it's not too worrying really. But if you're going to leave them for a week or a weekend and you think, oh, something will go wrong, then you should absolutely get a memory test done. And it's okay, the GP will do the basic tests.
That's great, thank you. Talking about more advanced tests in hospital, Sister Shelby, someone's asked a question. Are you supposed to do a lumbar puncture test to be diagnosed with dementia?
Not aware of a lumbar puncture
I'm not
test.
sure that's a common diagnostic test. Dr. Samir, perhaps you can add?
For younger people, sometimes.
Right. Okay. So if you're younger, so the person who's asked that question, if you're younger, then that would be a test that might be used. One of the questions we've had is about lifespan. Perhaps Dr. Samir, I could draw you back in again. So how long is a person's lifespan after they've been diagnosed with dementia?
So I never answer this question because some people live for 2 or 3 years. Some people live for 10 to 15 years. It's very easy to look up what the average lifespan is, but I purposefully never answer it because
it could be the cause of death.
Sorry?
Can dementia be the cause of death?
Yes, it can be number one on the list of causes of death. Absolutely. And it's the most common one, actually.
Right, thank you for that. So someone else has asked a question. What happens to a person's brain as dementia progresses that makes them less able to communicate, express themselves, express their thoughts, their feelings? What happens? Is there a process in the brain?
Shall I do that? So
I think
yes.
with you.
Yes. Yeah. So the first thing is, it depends what type of memory loss there is. So the vascular types of memory loss, it depends where the blood clot is, where the blood problems are. Okay. And if it affects the areas of the brain that are to do with motivation and to do with being able to say the right word and emotion, then those bits be affected. Just like when you have the blood loss to the bits that affect a movement, you lose part of movement. So it's the same thing, just a different area. With Alzheimer's, normally it starts in the short-term memory bits of the brain, which are very linked to emotion. Okay, so there's an area of the brain called the amygdala, which is really linked to emotion, and probably also linked to the sugary taste that people have. People want lots of biscuits and chocolates and things. And people find that that part of the brain degrades because of this protein buildup. It's a protein called amyloid and tau. Then these are the kinds of proteins that are there. The reason why they build up is really complex, and lots of research is going into it, but that's why we haven't got a cure right now. We know a lot about it, but we don't know everything. So so it really depends on where the buildup of these proteins or where the kind of damage is happening, and that leads to these mental health difficulties, because they're literally damaging the parts of the brain that control that.
And on that note, presumably, if it affects certain parts of the brain, you can also get seizures. Can you get fits in dementia?
Yeah. Yes.
Yeah. So we've had a specific question about that as well. So if that's brilliant. I'm sorry, Dr. Samir, you've been bombarded because we've had so many medical questions that we're trying to get through. I mean, and they keep coming. There's lots still coming through on the YouTube channel. Sister Shelby, if I could come to you and perhaps draw Keshri into this as well. You know, there are lots of faculties that are affected by dementia, such as people's eating, drinking, perhaps ખાવાનું યાદ નથી કે ખાવું પડશે, તરસ લાગે છે કે નહીં. You know, people lose that sense, right? Have you noticed that, Keshri Ba?
Yeah,
that, you know,
I think,
યાદ નથી.
yeah, so lunchtime has always been quite a big part of her life. So she has lunch at exactly 1 o'clock, sometimes a little bit earlier, but always her life is focused around this big lunch where it seems to be quite an occasion. And so she now doesn't really cook very much. We've called in, like you said, for extra support with that side of cooking, and especially working from home is quite challenging as well. So she tends to have lunch and then remember for a while, because she eats lunch quite slowly, so it's quite a big event in her day. But then later on, after about an hour and a half, might re-ask, "Oh, did I eat?" Or, you know, it might be a bit muddled. But then again, so she doesn't quite remember when the order of her day is happening. So whether she's had breakfast, if you ask her that prior to lunch, that part of her memory would have been gone. So it's too far before. She has breakfast, you know, relatively early, about 7 a.m. So that part of her memory would have gone, and then it's replaced with lunchtime. And then further on in the day, that will sort of erase. And then we start, you know, again, all right, do you want something to eat? And then it starts going again. So that's what you find on a sort of day-to-day basis.
So, Sister Shelby, what can we do to help and, encourage with the eating and drinking? Any practical tips you can offer?
With what Keshri just mentioned about the problems in understanding, recognizing that they're actually hungry, or they're feeling the thirst, or they don't want to prepare the food anymore, or lost the taste, or they don't like the certain types of food. So for example, leaving a drink all the time, so jug of water or something beside the bed or table, so that will encourage them or remind them that they need to have a drink, because that part of memory probably have already been affected and they don't feel that thirst. They may have lost the taste itself. They might not like certain food. So you probably need to understand their likes and dislikes. Like Dr. Shah earlier mentioned, that sweet butt probably is more active. They might like more of a dessert rather than actually the main course, which is something we find mainly in the hospital. Like, they will have their ice cream or their pudding, but the mains are always, that's always kept aside because they don't want that. So offering little and often. So if rather than giving him lunchtime, sticking to that 3 times meal pattern, perhaps you can offer little and often, so some snacks or something in between. And mainly elderly, they, like Dr. Shah said, they seems to be enjoying their biscuits more. A cup of tea, a biscuit is more working rather than giving a main meal actually. So further forward, there could be other reasons why their appetite is an issue. Yeah, it could be that they have got issues with their mouth.
No, that's great. Thank you very much.
Lots of issues. Yeah. I mean, so it could be issues.
No, that's useful to check
basically.
Mouth that they can eat.
Yeah, you need to understand that. Have they got any mouth ulcers? They got any fungus?
That's great.
Anything as such. Yeah. You can obviously get involved of the dietitian.
So
have a language therapist assistance to see if they have got any problems with swallowing, or do they need any kind of nutrition supplements. So there are other things that you can get help with.
That's great. Really useful, practical tips. Thank you, Sister Shelby. A couple of people have asked the same sort of question. And again, Dr. Samir, if I could draw you back into the conversation. Unfortunately, there are so many questions and we are going to have to end soon. But a couple of people have asked, what are the signs of end of life in dementia? So, I mean, Shelby, we see this at work, don't we? End of life, and I'm sure Dr. Samir, you see it in your professional work. So are there any specific signs that people are approaching the end of life with dementia?
And the specific ones, I think what you will see is a very rapid decline in their function. So it will go like this, then it will go like this. Yeah, and they might stop eating suddenly, might become very thin. Actually, very similar to what we see with end of life in many ways. Where people become very, very thin. They might stop eating. They might stop letting you help them. Yeah, the swallow might be difficult, and so one of the reasons that people die is because they have a chest infection, but actually the main cause is they have a chest infection because they can't swallow because they've got a dementia. So that's why the main reason is there. So sleep changes is a very big thing. So the areas of the brain that control the sleep. So if you just can't control sleep, then that's a sort of a brainstem thing. It's right, very, very basic parts of the brain are being affected. And that means that things are, accelerating at that point.
That's great. Is there anything you want to add to that, Shelby?
I think he's covered pretty much. Yeah, I'm happy.
So we have got still so many questions, but we are going to have to end at some point. So I'm going to come to the last question, if I may, before we just summarize. So Dr. Samir, are there any steps that one can take to improve the prospects of avoiding getting dementia in the first place?
So the chart that I showed earlier which I'm happy to share. But also, if you go to Google and put in Lancet Commission 2020, that's the sort of gold standard piece of evidence. And that chart is the really easy part to follow. So if you follow that and you can look at the percentages of the things that you can change on it. Really, a lot of it's surprising how much of it is hearing and how much of it is social interaction. And right now, and going out for a walk every day. It's some very simple stuff. But have a look at that. And that's probably the gold standard right now of what we understand.
So no, that's great. Thank you, Dr. Samir. So ઘણા બધાએ પૂછ્યું છે કે હું પોતાને dementia થતા શકી રોકી શકું છું કે નહીં. So that's the preventative question. તો હમણાં એવું કોઈ રીતે એવું નથી જેના લીધે dementia થતા રોકી શકાય. પણ અમુક જેમ ડોક્ટર સમીરે તમને અત્યારે જણાવ્યું અને એમના ટોકમાં બી આપણને કીધું અમુક પગલાં આપણે લઈ શકીએ છીએ. તમારું હાર્ટ, બ્લડ પ્રેશર, કોલેસ્ટ્રોલ અને વજન તમે જીપીની પાસે જઈને માપી શકો છો અને એ બધી વસ્તુ તમે કંટ્રોલમાં લાવી શકો છો. તમારે ડાયાબિટીસ હોય તો ડાયાબિટીસ તમે કંટ્રોલમાં રાખજો અને તમારા ડોક્ટરની સલાહ પ્રમાણે તમે બધી સલાહ સૂચન ફોલો કરજો. સિગરેટ ના પીવી જોઈએ અને ખાવા પીવામાં તમે ध्यान રાખો. શાકભાજી અને ફ્રૂટ વધારે ખાઓ. અને અત્યારે જેમ ડોક્ટર સમીરે કીધું તેમ વધારે બેઠા ના રહો, એક્ટિવ જ રહો તમે. અને હવે તો તડકો છે, વેધર બી સારું થવા માંડ્યું છે, એટલે તાપમાન બી સારું છે, એટલે બધા બહાર જઈને રોજ તમે થોડુંક ચાલો તો તમને કસરત તમારા મગજ માટે બી સારી છે. અને અહીંયા ચાર્ટમાં કોઈએ લખ્યું છે કે under 65 it's important to play memory games and keep exercising your brain. So on that note, thank you very much to our expert panel today, Geshri Ben, Sister Shelby, and finally Dr. Samir. Thank you very much for your very, very important pearls of wisdom for a very stigmatized subject. Thank you. Prafula Ben.
Thank you all very much. That was really interesting. And as Jyoti Ben just said, a very stigmatized subject that we've once again brought to the community and started a conversation about. Dr. Samir Shah, your presentation was really, really enlightening in terms of understanding some of the challenges, and the Dorothy app looks amazing. So I hope that will help many, many more people to understand the kind of basic symptoms and the practical things we can do. Sister Shelby, I'm so sorry we had a bit of sound issue with your presentation, but nevertheless, some really wonderful and helpful practical tips there from you. I particularly like the labeling of all the cupboards. I think I'm going to try that one with my mom, because she actually has vascular dementia and so has some difficulties and some challenges that we've discussed today. But, you know, I think there was some really nice, good, helpful things in there that people can do at home. And Keshri, your story, so many people are actually saying that that story is very similar to their story. They're saying that, you know, their loved ones were diagnosed a little while ago. There's one comment here about somebody who in their 90s was diagnosed, and they're saying, Keshri, their story is very similar to Bar's. So I think you will have touched a lot of hearts with that story that you just, you know, shared about Bar. And I hope it helps some people to understand the difficulties, the challenges, the emotions, and the turmoil that people must feel around the person. Jyoti Ben, you mentioned the point about, you know, mourning somebody who has dementia, because they're still here, but the person they were is no longer here. And I think that's true as well. One of the very long letters we had earlier was telling us that, you know, that person has wonderful memories of their mom who is no longer here, but mom is here. So it's a very difficult thing, I'm sure, to manage for people who are living with this. I want to thank all of you very much for giving us time and to bring this to the community. We've had over 340 people on YouTube. It's obviously been recorded, so lots of people will be able to take advantage of what you've said. Keep watching it. And I think right at the end, we've had about almost 285 people still there for the Q&A. So I very much hope that it's helped a lot of people. Jyoti Ben, thank you once again for taking out time from your busy schedule to help in the planning of all of this. Samir Bhai earlier was telling me you were very persuasive in getting him here today. So I think that's a good phrase, actually, persuasive. Yeah. And I think Nilesh Bhai, thank you for spending the evening with us when you have so many other things to do and manage Oshwal Association of the UK.
It was a pleasure.
Just want to thank my team in the background, the web team, who today is Nikunj Bhai and Hemal Ben. They're a bit camera shy, I think. Where are you? Oh, they don't want to come in front of the camera. They're just working behind the camera. But they've done wonderful today and given us lots of support. I'm sorry that we had sound issues with a couple of people, so there were a couple of messages about that. But the presentation you gave, Sister Shelby, the slides are obviously on there, so people will still be able to follow it really well. Right, so our next webinar is on the 22nd of April, same time, 8 o'clock, and it's on the subject of diabetes. So we're going to have the wonderful Professor Kamlesh Kunti with us, and Smita Ganatra, who is a dietitian. This is her professional job. She advises people on diabetes diets. And once again, we will have a story from the community, somebody who's going to be sharing a story of living with her father who had hereditary diabetes type 1. And so we look forward to seeing everyone again. Please don't forget to join us on the 22nd of April, same time. Jyoti Ben and I will be here alongside our web team, and Nilesh Bhai, if you're free, we'll see you on that day as well. So thank you everyone very much. Pranam Bada Ajay join Tiana Mate. Thank you. આવતી વીકે અમારી બ્રેક છે, પણ એના પછીની વીકે અમે પાછા આવશું 22 એપ્રિલના, અને ત્યારે આપણો સબ્જેક્ટ ડાયાબિટીસનો છે, તો પ્લીઝ બધા જોઈન થાજો 8 વાગે. Thank you very much, everyone.